welcome, and we will call the meeting of the Rutherford County Benefits and Insurance Committee to order. And our first item of business would be to approve the minutes of the last meeting. And I think you've received those in advance. Do we have a motion concerning the minutes? Motion to approve. Do you have a second? Mr. Sellers, did anyone see any additions or corrections that needed to be made? Okay. All right then. There being none, all of you in favor of that, please say aye. Any opposed? Okay. We're ready for a presentation on the financial condition of our insurance program. Mrs. Stinson.
Good afternoon. Today we have 2 months of financials to cover. We will go over the month of June, which is the end of our fiscal year, and then we will also cover the month of July. Here, refer to Fund 264 for the fiscal year 2009-2010 included in your packet. On the second page, you will find the information that I'll cover. The per employee per month for medical dental for June is $750.56. This is compared to $742.75 for the same period during the prior year. Average cost per employee per month for the fiscal year was at $686.70 compared to $680.85 for the same time in the prior year. This is a trend of 1.7% and is represented without the consideration of care here and other administrative fees. When you combine the plan performance with the care here results through June, the year-to-date average was at $718.92 compared to $710.92 for the prior year. During the fiscal year of 2009 to 2010, we had 196 large claims, which represented claims in excess of $25,000. We had 15 over $100,000, 2 were over $200,000, and 2 were over $300,000. The overall trend for the year was at 2.0%, and that takes into consideration the medical, the dental, the care here cost, and trending evaluation. For the year, we ended up at $41,717,992. The prior year was at $38,133,241 for a difference of $3,584,751. Are there any questions about that before I move on to the OJI? Regarding the on-the-job injury program, year-to-date costs totaled $941,855 compared to $1,546,848 for the prior year. Year-to-date totals represented 60.89% of last year's cost. We have worked to move out of our work comp claims, and we are continuing to see a decline in the number of work comp. That is one of our focuses as we continue to move forward. We'll begin reporting those numbers as part of our report package next month. If we move to July's results, the per employee per month for medical dental for July is $596.54 compared to $640.97 for the same period prior year. We've had 10 large claims exceeding $25,000 in the month of July. We had 2 claims of those 25 that were over $100,000. When you combine the plan performance with the care here results for July, we were at $620.30 compared to $669.75 for the prior year, creating a negative trend for the beginning of the year. For the on-the-job injury program in the month of July, we were slightly under 1% compared to last year's total in the month of July, with total expenditures at $59,378.25. Prior year in the month of July, we were at $67,622.06.
Does anyone have any questions of Mrs. Stinson? This looks like an excellent trend. I mean, last year it was just 2% over the previous year. Is that correct?
Yes, that's correct, and it's far below the national average for medical inflation.
What would you say a national average would likely be?
A conservative average would be somewhere between 8 to 10% is what we generally read.
So we've done a great job there. Thank you. Now, Ms. Anderson, do we need any approval on this?
No, sir.
Okay. All right. Does anyone have any questions of Mrs. Stinson regarding the report she's made regarding the last full year plus the first month of this year? So you have nothing to report to us that would give us any cause for concern at this moment. Is that correct?
That is correct.
Okay. Now we have, next on the agenda is the workers' comp and OJI statistics. And we'll call on I can't call his name. Mr. Goode. Mr. Goode will do that for us.
Thank you, sir. You have the report in front of you there. In the month of July, we had a total of 11 injuries requiring medical attention. You'll see the breakout of the types of injuries we had there. For the year-to-date, being January the 1st through the end of July, we have had a total of 112. Of that 112, 73 of them are recordable. We have 24 that required restrictive duty, 23 lost time duty, and then 26 were all others, as you can see from your report there. On the next page, you'll see the graph breakdown and comparison of the last 2 years to this year. And you can see right now we're kind of on a steady trend. I would like to point out one thing that we did this past summer. In the month of March, Tim Street in our department started doing some training with the school custodians, the lead custodians, because we'd seen a peak in the month of June and July. When the school's out, the schools go through a process of cleaning the schools, waxing the floors and things like that, and we usually have a peak. Last year, during the month, that time period, we had 18 injuries for custodians. This year, with the training, we started the training process with the lead custodians early on in the month of March. Then we followed up when the summer hit and the school was out. The first injury, we attacked it. We contacted every principal, every lead custodian, and refocused their attention. And I'm pleased to report that this year, during the month of May, June, and July, we had 4 injuries from the custodian. That's a drop of 77% from last year to this year, from 18 to 4. So I just wanted to say thank you to all the lead custodians and everybody at the school system, Board of Ed, that made that training possible and those results. If you go ahead and turn on over to the next page, you'll see that the total dollars for the month incurred was $45,434. And then if you go ahead and turn that over for the month of July, you'll notice that the claim count for the Board of Education was 4, and the dollars were $36,434. And for the county general, the claim count for the month of July was 7, and the total dollars incurred there was $9,000. Are there any questions?
Okay, thank you, Mr. Goode. Another great report, and
thank you.
As you just said, thank the school board and the members of our safety team in both the insurance office and the school board for really paying attention. It's made a major difference. That's really great. Okay, let's see then. Next, we have a update on our wellness. Miss Kelly Perrions, is that correct?
Our Get Moving Exercise program will end next Tuesday. This has been a 10-week program. We've visited different facilities and had a different activity each week. The intention of this program is meant to let employees find out where they want to work out and what they want to do. We've tried several things from martial arts to Pilates. We've had 30 people sign up, and attendance has varied throughout the program. On our financial wellness, Ted Beatty just presented retirement planning to 23 employees on August 17th in the courthouse. Kathy Mead and I have led warm-up walks, getting ready for the Heart Walk. We led the walk at an indoor track at Patterson Park at 11:30 on lunch. Our next warm-up walk is September 16th at Patterson Park. Like I said, it's on the indoor track, so come join us at lunch for some exercise. The Heart Walk will be on November 7th this year at MTSU campus. Our last HRA clinic was at the EMS department. It was on July 14th with 12 assessments completed. Journey to Freedom was taught by Elizabeth Nunley of Care Here. Denise Agee took employees on a grocery shopping tour to help them learn some healthy options. And Care Here Way kickoff was last Tuesday. This program will run from September 21st to November 2nd, and there's still time to sign up if anybody's interested. It's going to be held from 5 to 6:30 after work. The Care Here webinars this quarter included Coping with Crohn's, Strategies for Change, and Stress Reduction. Recorded versions are available of any of these if you can't attend the live webinar. For our upcoming events, our Walking for We contest closes on September 7th, so make sure all your activities logged and up to date. Our next Lunch and Learn will be Taking Sleep Seriously, presented by Warren Brett, sponsored by Cigna. And finally, I want to talk about Coordinated School Health sent a survey out in May to all of our employees, and the results found that many employees associated Get Rather Fit with just the Biggest Loser contest. So therefore, we're changing the name of the program. We're running a contest. The winner will get a $500 travel voucher. So we're just trying to make a total wellness have a new face. This ends on September 17th. And all the details are on the website that you can find on the county insurance page. Also from the survey, we learned that employees requested many programs that we're currently offering. Therefore, Kedri Marsh of Care Here and I are visiting all the RC schools to promote our program. We intend this promotion to increase HRA participation and encourage employees to take advantage of free benefits that we have to offer. Anybody have any questions? Thanks.
Okay, thank you, Kelly. There's a whole list of programs, good programs, that we just hope that we can encourage more people to participate in. Okay, next, I think we have a document that we've...
Regina has a question.
What's this? Oh, excuse me, Ms. Harvey?
Thank you, Mayor Burgess. Since we're going to be talking about our next item, the Gatsby reform, and we have a couple of people that would like to speak on that. Keith Cornelius, and I know Rhonda Houghton is here to speak on that. I'd like to make a motion that we change the agenda to allow them to speak before we discuss the Gatsby document.
Okay, you've made that motion. Is there a second? Mrs. Barnes. Any discussion? All in favor, please say aye. Aye. Any opposed? Okay, so we had Mr. Cornelius. He was already listed on the agenda, but we'll let him go first since he was already listed.
Thank you. I'm Keith Cornelius, president of the Rutherford Education Association, which currently represents approximately 1,600 educators here in the county. And I just have a few talking points for you this afternoon. And I first of all thank you for allowing me to address your committee and speak to you. We realize at Rutherford Education Association that we do not set the rules of the plan, nor are we any kind of a plan administrator. However, teachers in this county have long had an expectation of insurance benefits and certain retirement benefits when they have served all of their time in this county, especially those with 10 years of service and greater. We feel that when someone invests, especially nowadays as mobile and transient as our society is, when an individual invests 10 years of his or her time and more in one job, that pretty much demonstrates a commitment to the county and to the system on that individual's part. And to lose pharmacy benefits for that particular group is very costly to them, because you're talking about a reduction in retirement income when that happens. This is also, understand that teachers, when they retire, teachers contribute to the Tennessee Consolidated Retirement System out of their salary here in the state the whole time that they're employed. It's 5% of their gross salary, and teachers have no say in that. It's a mandatory compensation or contribution, excuse me, to that fund. And at retirement, teachers receive 48% of their average salary for the last 3 years of service. Now, to change eligibility rules with little notice, it pretty much gives Rutherford County Schools a retention issue. This causes us to lag behind with retention, and it causes us to lag behind in benefits. And teachers simply want the transparency of any kind of major rule changes that are coming to them and that they're going to be faced with. They do not like to be all of a sudden learn of drastic changes without very much input. I can tell you that had there been notice or more of a transparency there, then the room would have been filled with several teachers that would have voiced opposition to some of these changes. I have been asked, and just telling you respectfully, I've been asked by a multitude of teachers since the summer, since late May, to compare the state plan for local educators to the current county plan. And teachers of Rutherford County, the Board of Education employees, do represent the largest block of participants on our county plan right now. I believe it's currently at 70% or somewhere close to that. If I'm wrong on any of my figures or any of my guesstimates, I'll call them, then please feel free to correct me. And Rutherford County, the Board of Education receives from the state of Tennessee through the BEP funding formula, which is fully funded again this year, 45% of the state plan cost for each BEP position that the county has. Now, this is regardless of whether a teacher participates in the county plan or not. The county still receives 45% of this money. Now, for instance, if the state plan was costing $5,000 for administration, then the county receives $2,250 for each individual in a BEP position. Now, let me say, I will say this about Rutherford County Schools. The school system typically does fund positions well and above the minimum BEP requirements. But we do, the Board of Education does receive that 45% regardless of teacher participation or not. Now, how many teachers does that affect? I don't know. I don't have that number. I'm sure Mr. Sandvig could give those numbers readily if he were asked. He probably knows how many teachers elect not to participate in the plan, but that we still receive BEP funding on. I'm unsure about that. Right now, the Rutherford Education Association is simply on a research mode. And since I do represent these teachers and I have been asked by them to find this out, we are on a fact-finding mission right now with the Tennessee Education Association to see exactly right now what the state plan would offer versus the county plan. So teachers will be looking at that. And I know that under Tennessee Code Annotated right now, it does require 50% plus one of all eligible, and let me say Board of Education eligible participants. And that does not mean that you have to be a member of the Rutherford Education Association. That means everyone that is eligible, a board employee for the insurance plan, it would take 50% plus one individual to cause us to move from the county plan currently to the state insurance plan that we have. But that is just simply a fact-finding mission right now. We do have a lot of individuals with 10 to 20 years of service in this county, a lot of teachers that are far from age 55 even, or far from age 60 right now, that this is going to affect. And with all due respect, the GASB 45 is not a law. This is simply a recommendation, if you would, that has been put out as a method of reduction in insurance benefits. So GASB 45 is not a law. It's not a state law, and it's not a federal law. It's a recommendation of a reduction of plans. Now, if I'm wrong about that, and the Tennessee Education Association was the one that informed me that it is not a law, so if we are wrong, please let me know, and I will stand corrected. But that's what I have to say, and I just ask that you would reconsider, especially from 10 years on upward, that these teachers are faced with losing their pharmacy benefit at age 65 from retirement. This is, again, a significant reduction in someone's income when they are retiring from the school system, and I appreciate your hearing me this afternoon. And do you have any questions of me? If you do, I'll be glad to try to answer it. I can't promise that I can answer it.
I just want to make sure I'm clear on a couple of things. You said, if I understood you correctly, it's to the county's advantage to leave the Board of Education employees on our insurance plan because of the $2,200 and something that we received? No, I didn't say that. I said that the only thing I said was, and let me say this, REA, when we do this study, REA will not recommend or take any kind of a position to any Board of Education employee to say we support this plan versus another plan. REA is simply the research vehicle, and that's what we're doing right now. All I'm saying is that the Board of Education receives through the state 45% of the total state plan cost for an individual's insurance, regardless of whether or not they participate in the plan. And the only other thing I said is I believe, and Jeff may know the answer to this, or Paula would certainly, that it's probably about 70% of all of the participants in the Rutherford County insurance plan right now are Board of Education employees.
Okay.
Melissa, that money that he's speaking of that the state gives, is that going to replenish our insurance fund, or is that money going to the Board of Education?
I'm going to have to defer to Jeff on that in the absence of Lisa here. I'm not sure.
Well,
there are two cash flows from the state. The 45% that Keith is talking about is for active employees. That is a revenue, part of the BEP revenue into the Board of Ed budget. That is just for the current employees. Then for the retirees, the retired teachers, not classified staff, there is a payment from the state that goes straight to insurance, which is less than the 45%. And that piece is the one that is tied to the retirees.
okay. Keith, we appreciate that. I mean, we'll take all your comments under advisement. I just want to make the last statement you made regarding GASB. You said that GASB is not a state law. That's true. GASB is a government accounting standard board, has made a ruling that all of municipalities, government organizations have to put on their balance sheet the liability that we have for retiree health care benefits. So that's a number that has to be actuarially computed by an independent firm to tell us exactly what the cost of these benefits that we have promised or we're going to prepare in the future is going to be, and that's exactly what we've done. So it's not a method of reduction. It is only a ruling that they have made that says you must put the actual current and future liabilities on the balance sheet so that all of the citizens, all of the people that are participating in this process know what our exposure is. And that's where we've started. And so the method of reduction is completely independent of that. We've just chosen to determine that that liability was enormous. It's $30 million a year, so that's why the adjustments have been made in the actual plan itself. Okay, now, I believe that we have one other person that wishes to speak, and we'll let Mrs. Rhonda Holton please come forward.
After listening to Mr. Cornelius, I'm sorry to say that he was representing that group that's not yet 55. Well, I'm representing that group that is over 55. So this is a little difference in that. Once again, I would like to thank you for the opportunity to address you. I have spoken to some of you over the phone and some of you in person. But today I just wanted to give you a face to put with some of the decisions that you're making. My name is Rhonda Holton. I'm currently the principal at Iggerville School. This is my 35th year in education. And as of December the 31st, 2010, I think when this actually takes effect, I will have been employed by the Rutherford County Board of Education for 14 years and 155 days. I came to Rutherford County in August of 1996. It was after I arrived that I discovered that Rutherford County was not a part of the state insurance plan. I just assumed that all teachers were on the state plan. That was a bad assumption on my part. I sort of panicked, but at that time there was a nice lady at the board named Miss Crosland, I'm sure some of you know her, who worked for the board. And she assured me that everything would be fine and that I would have insurance. I took out a COBRA policy for 3 months to cover any existing problems, and I was covered then at that time with W.C. Beeler. I learned later that I would have to be with the county for 15 years for the county to cover my portion of the insurance. That was not a problem for me because I was not ready to retire at 30 years. Then last May, I found out from my assistant principal by accident from a friend of hers that the insurance had been changed and I could no longer retire after 35 years with the county. If I did retire, I would be left with no insurance at all. I was overwhelmed by this news. I consider myself a strong individual and most of the time a problem solver. So the reaction that I've had to this has shocked my family and my friends. I'm not a crier. However, each time I talk about this subject, I tend to sob. It has become very embarrassing for me. So therefore today, I typed up these notes and chose to read them to you. I have worked since I was 16 years old. I'm married, I had a child, and I put myself through college. I've never asked for a handout from anyone. I'm a planner, and I planned for my future. That future included retirement pay and insurance. Now I'm faced with the reality that this group doesn't feel that I deserve or have earned the right to have insurance. I feel betrayed by the people that I trusted to look after my best interest. I'm in the business of educating children. I myself have taught or supervised the teaching of reading, writing, and arithmetic to thousands of students. However, at school and at church, we also teach children to treat people the way they want to be treated. I feel sure that the members of this committee have somewhere some source of insurance and would not vote to put themselves in a position to have no insurance. I'm just asking for that same consideration. I'm asking you to reconsider and grandfather in the people who were promised the ability to have insurance. In closing, I have one more thing that I would like to read to you. This was appropriate in the year 1942, and I think it still is today. First, they came for the Jews, and I did not speak out because I was not a Jew. Then they came for the communists, and I did not speak out because I was not a communist. Then they came for the trade unionists, and I did not speak out because I was not a trade unionist. Then they came for me, and there was no one left to speak out for me. This was written by Martin Niemöller, who spent his time in a concentration camp during World War II. So today, I am speaking out for me and others who I do not know their names, who have also been affected by a small group of individuals who chose to change things that will adversely impact a large group of trusting, hardworking individuals. I thank you again for your time, your service, and your consideration. Thank you.
Okay, thank you very much, Mrs. Holton. We appreciate that. Okay, we're ready to move on then to our next agenda item, which is a final GASB document which outlines the changes that have been made over the last 2 years. So, Mrs. Stinson, if you would point out to us whatever you'd like to point out there. Yes. It's a document that's 99% the same as we've had heretofore, but
during last insurance committee meeting, we noticed that there were some clerical errors. So when we reference that this is a final document, this document is just to indicate that we have removed the clerical errors that were identified last time. I'll further go on to say that the dates currently reflected on the document are correct in what time period it will be affected, either on June the 30th, 2010 for new hires, with the remaining classifications thereafter on 12/31/2010. The intent all along under the GASB review was to not impact those individuals who had 20 plus years of service with the county. And you'll read on this document that it does indicate that those individuals with 20 or more years of service as of 12/31/2010, if they do not meet the years of age and the years required on the plan, that they can accumulate that after 12/31/2010. For all other age groups, all three categories must be met prior to their retirement, as read in the document.
Okay, thank you very much there. So read that document over. It's something for you to keep and refer to, and it is hopefully the cleanup of the document that we've been working through over a long period of time. Okay, we're ready for some discussion regarding health care reform.
Mr. Sandvik has his hand up.
Mr. Sandvik, you had your hand up. I'm sorry.
Well, and this was the point I was trying to get to back at the May meeting, I believe. I would like to propose an amendment that will put the 10 to 20-year employees back in the position they would have been in if the county hadn't started paying anything toward retirees' benefits. I think for the 2000-2001 fiscal year, or maybe the 99-2000 year, we started that. And prior to that, the retirees paid 100% of the cost. Now, for the retired teachers, there was that state payment, which was then applied at the insurance office and reduced theirs somewhat. And there was no prescription coverage for our retirees after they were 65, is also my recollection. And so that would put that group of employees, so they would have that option to be back where they were when they were hired if they are not at that 15-year mark right now.
And what was the year when you said that was in effect?
It was 99-2000 to 2000-2001, and I am not certain.
Okay.
If I could ask a question just for clarification, since that predates my employment here. So I understand correctly what you just said, that 100% of premium could be paid by those individuals retiring, and you all would use the money from the state plan that the Board of Ed receives to offset.
No, it would still flow to the insurance department like it does at present.
Okay, to offset the premium amount. So this would be equal for all employees, which is the point I'm going to make, both Board of Ed and County General, in terms of how it's handled.
But for people in that 10 to 20 year category.
Okay, Mr. Hall.
I just have a question. What wasn't the, at that time, and Mary may remember this, but didn't we get a reimbursement from Medicare at that time was it for the pharmaceuticals at all or is that just for the healthcare part?
I think that was a later change.
That was a later, okay.
That we went with, and then it kind of backfired on us.
Okay, yeah. Okay.
We're still participating in that retiree subsidy on Medicare.
The retiree drug subsidy. To further clarify, Jeff, what you're saying, the state cert, or however you refer to it, is only for those individuals post-65, correct? Not pre-65 retirees? The subsidy that you're referring to that is a positive against the premium amount
I think
is for post-65 only.
Pre and post, I believe. It isn't pre?
Let's say this, Mr. Sandvik. I think would be appropriate if you would just make a motion that the area of discussion that you are suggesting, that we take it back for study by the appropriate people and come back with all of the information discovered with respect to what the actual facts of the matter are and what the options are and what might be a recommendation.
Okay. So, you think a motion for the subcommittee to meet again, or just to have this study done at actuarial cost?
Is there a standing subcommittee here that typically reviews this stuff? So if you would just make the motion that the subcommittee that typically reviews these benefits to address this issue and report back at the next meeting.
Okay. And I would like to send back to the subcommittee the specific proposal of modifying the 10 to 20 year of experience category in post-retirement health insurance to allow that group of employees who don't meet the 15-year mark as of 12/31/2010 to maintain their insurance and pay 100% of the retiree's cost less any state reimbursement that we get.
Okay.
And that be brought back to the full committee.
All right, so you have that, I believe, Ms. Anderson. That was clear. Do we have a second? Mrs. Barnes. Now, do we have other discussion? Mr. Hall.
I just want to say he was talking about, Mr. Cornelius was talking about that if they had this thing snuck up on them, and if he had extra time, that they would have been able to come up here. I mean, this subcommittee has worked for 2 years on this thing. These benefits have been talked about for over 2 years, maybe even 3 years. And I don't know if you just started on your job and maybe you're just getting in the loop now or what it is, but this has been going on for a long time. And these people have really worked hard, and I just don't think it's fair for him to come up here and act like this is something that just snuck up on us just now. I mean, we're trying to work on getting these benefits for the people that are 25 and 30 years old that are working for the county now that would like to have some benefits down the road. I mean, we see this all over the country. You know, these pension plans and stuff like that are going broke, and they're looking for bailouts in Washington. This committee right here has taken the preemptive steps to try to make it where everybody could have some benefits down the road. And I just don't think it's fair for somebody to come up here and say to us that we just threw this thing out here. And I really do appreciate all the work that the folks, Jeff and Mary and everybody has put together, because it's a tireless job and it's a thankless job apparently too. So I want to thank you personally.
Well, thank you. That point well taken. Okay, we have a motion and a second. I mean, they're going to review this, but it would be an option whereby those employees in that age group would be allowed to pay 100% of the premium. Ms. Barnes, do you want to make a comment?
I want to comment before we take a vote, please, in reference to Greg's comments. And I understand what you're saying, because we have listened to this for 2 years, and I think this committee really has worked hard because we've tried to understand GADSB and all the implications. And it's been a hard process for me because I'm not a numbers person. But we expected for all of our employees to view this and watch this, and they didn't, because this is not of interest to them, or I shouldn't say not of interest. It's not something that they would tune into and observe and take notice of unless they were told to. And while our retirees came forward and did come in masses because someone got their attention and said, hey, watch, the rest of our employees did not. And if that's my fault for not sending it out, if that's REA's fault for not sending it out, so be it. But now it has come to the surface, and they are concerned, and we are getting calls constantly regarding this, especially that age, that group of 10 to 20-year people who may have been left out. And I don't think the numbers are tremendous in that particular group who don't currently meet that grandfathered clause. And I think that's why we support Jeff's recommendation to look at this again. And we did bring that up in May, asking to go back, and we didn't have any action on that. So I think it's an appropriate motion. Thank you.
Okay. Mr. Sandvik? Whoops.
This should be a fairly cost-neutral proposal. There is, yes, some adverse selection.
Yeah.
But
well, we're
other
going
than that, it's fairly cost-neutral.
We'll let your committee bring us back the pros and cons, okay? And Mrs. Hickerson.
I just want to, they spoke on the Gatsby and everything, and I just want to put some points out that we may have forgotten. In the front of the health plan document, booklet, whatever the fancy word is for it, in the front of it, it says, subject to change. And so we just need to, I mean, I was promised it, if you want to say that, when I was hired. But I also hope in 10 or 15 more years, I'm still with the county, I still have a current health plan that I'm actively in. And if we don't do something, that could go away or be so costly that our working employees can't afford it. And just to make a couple of little other statements here, we do make it easy for people when they have a problem with our plan to come. They address it to the insurance department. They see it's big enough, they'll bring the plan or change to us in question. And we're easy and we sit and listen. And sometimes we've made changes to the plan for what some people want to help them out, and it may help a few others out. So we just need to make sure that everybody remembers how easy it is to come to us with problems, and sometimes they get changed and sometimes they don't. Sometimes they're oversights. You know, you mean this, but it's easy for us to do this. And my question is statement on Greg's part, how easy will it be to see if it's transparent when the state makes changes? There's just things that everybody needs to look at, but just remember that in the health care booklet, it says, subject to change.
Thank you, Mrs. Hickerson. Points well taken. All right, is there any other discussion? We do have a motion for our subcommittee to convene, study, and make a thorough and complete report at the next meeting. If there's no other discussion, all of you in favor of that, please say aye. Aye. Are there any opposed? Okay. Looks like we are going to do that, and we'll anxiously await your report at the next meeting. Let's see. Next, we need to talk about healthcare reform. Now, life will really get complicated for all of us, and our plan will change because of healthcare reform. Probably. I don't know. It's going to be an interesting but difficult journey for us. So, Mrs. Stinson, would you sort of tell us where we have come to this point with respect to healthcare reform on the national basis that's going to impact our county?
Yes, I will. Prior to Lois Miller, the previous insurance director, leaving, she began the process of obtaining information regarding professional services as a healthcare reform consultant. The reason she did that is because the acts are very complex. There are a lot of points inside of the act where you are required for actuarial studies to be performed, and we know of changes that are coming in the 2011 year, and there are many changes that will be coming in years to follow as well. In reviewing the acts, we have decided that we needed to seek some professional services to assist us along the way of ensuring that our plan can maintain the grandfathered status that it currently has for as long as possible. I provided to the committee members a chart that shows you some of the changes that will occur beginning with 2011 and years thereafter. If we were to lose our grandfathered status, there are certain financial there's certain benefits that would be enforced upon our plan that could have some significant financial impacts to the plan. And we need to know at what point we may be affecting our plan and what those costs are. When Ms. Miller sent out the request for information about professional services, the scope of services she requested was compliance expertise, benefit structure recommendations, cost modeling, which is the actuarial portion, and communication pieces, and development of a go-forward strategy, so we'll know how to adjust our plan in coming years. Aon was reviewed along with Cowan Benefits and Deloitte Consulting. And today, and those individuals in the subcommittee, which consists of Mary Hickerson and SONYA Stephenson, Jess Sandvig, Lisa Nolan, and myself, received a presentation by Deloitte. We found in their presentation that it exceeded the other offerings of services that were proposed by both Aon and Cowan Benefits. Specifically, it had one component that was not included in their benefits. It gave projections out to the year 2020, and it also gave a workforce planning model, which is of interest to us because there will be a change of requirements for full-time status, which will affect how we look at both seasonal and part-time employees and their eligibility on the plan, which will have financial impact to us. So we found that particular portion of their report interesting and beneficial to us. The lead for the team, the local lead for the team at Deloitte Consultants is Greg Drennan, and he has over 21 years of actuarial and employee benefit consulting experience. Currently, his primary focus is on the public sector. He understands government entities well, and he is accustomed to looking out in the best interests of government entities. His clients represent Metropolitan Government of Nashville and Davidson County, Mecklenburg County in North Carolina, Fulton County in Georgia, U.S. Government, and the U.S. Navy. I've also provided the committee with a complete biography of Greg if you'd like to review that. The total fee related to the services offered by Deloitte is $60,900. This includes the diagnostic report, which will serve as the basis for impacts of the Act beginning in 2011 and will include the projections up to 2020. Additionally, the fee includes ongoing education and availability to consult both in person and via email as changes are made to the law or consideration of impacts to the medical plan is needed. Weekly updates and newsletters will be provided to educate us about the regulatory updates, and additionally, ongoing assistance with benchmarking and analysis of market trends are included in their fee. We felt very confident about Deloitte's capabilities to assist the county in dealing with the health care reform, and I wanted to present this information to you today for consideration.
Okay. So, if we sort of summarize this, Mrs. Stinson, we have taken requests for proposals, and we received three proposals from three consulting firms that propose to help us, guide us through the process of determining what the impacts are going to be from this health care reform over the next, what did you say, through 2020?
Their projections go through 2020 in terms of financial planning.
Okay, and what you want us to do, are we going to let Deloitte make a presentation, give us their view of this, or how do you want to address this?
The presentation was already provided to the subcommittee, and the subcommittee gave a positive reaction. Mr. Drennan is here today. He can approach the committee if they'd like to ask questions of him. Okay. All right. And those of you that are on the subcommittee, do you want to make any comments in support of this recommendation that your group is making, or... Let me ask one question. We know that this health care reform, it could be changed from time to time, from month to month. And if those changes do occur, does that affect what Deloitte will have to do, their scope of work? And are they willing to be flexible enough to address those changes when they do occur on the fly, you might say? Yes, if there's considerable changes in the law, they will go back and adjust the benchmarks that they have established for us in the base study that they do. The bottom line is we have to do this. The health care reform is not optional for us, and we need to ensure that we are protecting the county in the interest of the insurance plan by having the right consultant paired with us as we go through this process. Okay. And would you again, for me, please, just sort of distinguish the reason that the subcommittee
thinks that Deloitte is the best choice among these three proposers.
Yes. First would probably be just Mr. Drennan's background in dealing with the governments and different public sectors and his experience in that area. Secondly, Deloitte is a nationally recognized consulting firm. They have local representation, which we have easy access, which was important to us. Lastly, their fees compared to the fees in proportion to their scope of services was competitive and below that of Aon, which had the second closest offering in terms of the scale of services and the type of reporting that they could provide. And lastly, the ease in which they have provided us information in the format in their review made us feel that we could easily take the information that was provided to us and make decisions based off of it without any additional expertise or involvement of legal or other actuarial services.
Okay, you might notice that I'm asking these specific questions for a purpose. I just want to be sure we're doing the proper things when we actually approve contracts, agreements, etc. The process for a request for proposals is completely different from straight bidding of equipment and other types of things. This is a professional service, and so we do have this ability to do this, but I want this group here to hear enough and ask enough questions that you're willing to say that we endorse and concur with the recommendation that the study committee has made with respect to the selection of Deloitte as the finalist with respect to these requests for proposals that we have made. So I'd like somebody, if they're comfortable with that, to make that motion.
I'd like to make that motion make the motion to approve this company as the consultant based on the need that the county needs a professional that handles this daily instead of trying to let the insurance director or somebody in her office try to keep up with something that is changing daily, hourly, or whatever. So, and I was on the subcommittee, so based on the way they presented it and the information that could easily be brought to us on the committee standpoint, I make the motion to approve this company.
And this body is concurring with the recommendations of the subcommittee. Okay, do we have a second? Mr. Sandvik. Other discussion? Mr. Hall.
I just want to ask, is this firm also doing some other government entities around us or close by? Or anybody similar? Are they also bidding where they'll be working close by with the state of Tennessee or state of Kentucky or anything like that?
Mr. Drennan, would you like to come up and address Mr. Hall's question?
This is Mr. Gary Drennan. Is that correct?
Greg Drennan.
Greg, excuse me. I had the G right. All right, go ahead, Mr. Drennan.
The short answer to the question is we're working with public sector entities all around the country. As far as local entities, not so much. We work with the state of Kentucky on lots of different things, and we work with large states as well.
I just want to say that $60,000 as a percentage of our plan, that's 0.1%, 0.5 of 1%, something like that. So yeah, so it's a small portion to have some good advice on how we need to proceed.
Oh, 0.5 of 1%. Okay. All right, Mr. Venus. So the answer is locally they're not engaged with others, but Deloitte is a large national firm that's, I'm sure, working with many other entities across the country, and others will come on board, I suppose.
We can provide local references if you need to.
They have local references, just not a government entities. Vanderbilt's one of their clients.
Okay, we have a motion and a second. Is there other discussion to approve and recommend the engagement with Deloitte to provide healthcare consulting fees through this healthcare reform? So we have a motion second. Is there any other discussion? All in favor, please say aye. Aye. Any opposed? Okay, thank you, Mr. Drennan.
Thank you.
Now, this is an actual contract we'll have to execute, so we'll have to take this recommendation on to the Budget Committee.
Yes, correct.
Okay. Now we're going into something a little further down the body here, foot orthotics. And so we'll talk about something else different at this moment. Mrs. Stinson.
Okay. In 2006, former Mayor Nancy Allen signed a resolution regarding extracorporeal shock wave therapy, which is a treatment for plantar fasciitis. One of the conservative treatments that are required prior to ESWT is custom foot inserts, custom shoe inserts. The plan currently excludes those. I believe it was an oversight at the time that the resolution was made that we needed to modify the plan to also include coverage for the shoe inserts. Shoe inserts not only treat the plantar fasciitis, there's other medical conditions that it treats as well. I've provided the committee with an overview of the language that we would interject into the plan, and we are recommending today that we adopt the coverage for the foot orthotics into our plan.
Okay, do you understand what she's asking here, what she's suggesting, what she's recommending? Mrs. Crace says she understands this.
I've got a question.
Yes, sir,
If in 06, Ms. Allen signed a resolution to include orthotics, but the plan disallows orthotics, what have we been doing the last 4 years?
Well, let's clarify that point. If you read carefully there, first, the patient had to go through these conservative approaches prior to being able to get this ESWT. In other words, the patient had to pay for custom molded foot orthotics before you could have this other special high energy treatment. We're suggesting, they're recommending that we don't require them to do the custom molded foot orthotics. We put that into the plan.
I thought the way Ms. Stinson said it was a conflict between the resolution and the plan.
No.
Right, okay. Well, I agree with approving the orthotics to start with.
Did we make that somewhat clear, hopefully? But, yeah, we're wanting to allow our current plan to provide for the custom molded foot orthotics and not make that a conservative treatment prior to your ability to get this shockwave therapy. Okay, if you understand that, they would have to draw a resolution allowing that amendment to the health insurance plan document, which we don't have before us, but that's what the recommendation is.
Right.
Okay, do we have a motion concerning this? All right, a motion to approve, and Ms. Anderson will properly word that motion to include the allow for the custom molded foot orthotics to be a part of our standard health insurance plan. We have a motion. Do we have a second? Second, Mr. Gammon. Is there any other discussion? All of you in favor of that, please say aye. Aye. Any opposed? Okay. Open enrollment.
Open enrollment this year will be October the 4th through October the 29th, and it will end at noon. We will have payroll attachments that will go out in September prior to the October the 4th date. And we will also have mailings that will arrive at the home that will give the benefits guide an overview. We will not have mandatory meetings this year. They will be optional meetings because there's not a significant amount of changes to the plan. And it will be, those meeting times and locations will be available to all Board of Ed and county employees at every location listed on the booklet. One thing that we are doing this year is on October the 23rd, we have our Employee Appreciation Day. We are enhancing the vendor services at the Employee Appreciation Day with Cigna and with Cowan Benefits so that individuals who need assistance during the enrollment process online can come and receive assistance in determining which plan would be best for them and can actually enroll online at that time.
Any questions regarding that? I'll back up. I didn't read, we all have our document here regarding the foot orthotics, and near the bottom of that page, she completely spells out the language that will be included that will allow just what we approved previously. So they already have that there, and they'll make that a part of an appropriate amendment to the health insurance plan document. Okay, is there anything else on open enrollment, Mrs. Stinson?
No, we just wanted to provide that information.
Okay, now we want to talk about Care Here no-shows. And what would you you like to say about that?
All right. At the April 23rd, 2009 meeting, Ms. Miller proposed, and it was passed, that a $25 fee be applied and deducted through payroll or billed for retirees for a missed appointment. The reason that this was proposed was to try to alleviate the number of no-show appointments that we had at that particular time, and it was important to the committee that a grace of one appointment be allowed, realizing that everyone's lives become hectic. And that particular $25 fee went into place on January the 1st, 2010. So now we're 7 months into the year, and I've taken a look at what the impact of that $25 fee has resulted in. At the time of Ms. Miller's review, she had 9 months of experience, and there were 916 no-show appointments at the time the proposal was made. At the conclusion of 7 months, we were at 449 no-show appointments, with 50% of those appointments occurring at the Blackman Clinic. The second location with the highest no-shows is out at our Walter Hill location. So I would like to propose two things that we were going to do to address that. One is we are going to assess, and we have completed our assessment of utilization at the various clinics. No show or lack of ability to make appointments because appointments are being booked and then individuals aren't showing was a major concern in the survey results that our wellness coordinator recently received about the Care Here services. Recognizing that a lot of our employees work in the Murfreesboro area, we would like to move the hours at the Stewart's Creek Clinic in the morning out to the health department on Friday. Currently, we only have a half a day every other Friday allocated at the health department. We feel that is a more central location inside of the county. So we would utilize the 4 hours that we currently have at the Stewart's Creek location to extend our offering at the health department. It would allow, on one particular Friday, the health department would be open for 8 hours of clinic time, and the following Friday, we would alternate between 4 hours in the morning and 4 hours in the afternoon on a rotating basis. So that's one thing we'd like to do to address the difficult time that people are having to schedule appointments. Secondly, Care Here has now put on their online scheduling system a block so that people cannot book multiple appointments and then decide, at the last minute which time works best in their schedule that day, and either forget to cancel it, because we do see people that will have a couple of missed appointments in a day, or cancel at last minute so that other people can't have the accommodation of going to that particular appointment. Lastly, because 87% of the individuals reflected in that 449 that have missed appointments this year, they only had one episode of a missed appointment. So it would lead you to believe that missed appointments aren't widely viewed as an important occurrence. Unfortunately, every time there's a missed appointment, it costs the county on average $40. I would like to propose that we move from the one grace with a $25 thereafter penalty to a flat $15 penalty per occurrence beginning in 2011 to alleviate the no-show problem and the loss of money that the county is experiencing through the clinics. That's far below what a private practice physician would charge for a no-show appointment. Their fees are typically between $25 to $50.
Okay, let's go back and review this, Ms. Stinson. You made several recommendations there, and I'm trying to determine which of those does this body need to act upon. You talked about changing the hours, moving from one location to the health department. Is that something that this group discusses and approves, or is that something that you have put in practice as a matter of operation in the past? I'm just asking for my information.
Right. That is something that we were intended to put in operationally. We're not reducing the number of hours available to the employees, so we didn't feel that that was something that needed to be addressed. The reason I provided that information was so that the committee would know that we are not merely just suggesting a monetary type of proposal, but that we are looking at multiple ways to alleviate the no-show problem.
Okay, so that was just for information. So the piece whereby you're requesting the change from charging the $25 for all no-shows in excess of one, we charge $15 for each occurrence of a no-show.
That is correct.
That is a policy change that you're asking that some discussion takes place on. Is that correct?
Yes, that's correct.
And that's the only thing that this group would really need to address.
Yes, that is correct.
Mr. Jordan.
I'm trying to remember. I remember the conversation last year. We implemented this. How much time do they have to cancel an appointment before they're penalized? Is it 12 hours, 24 hours, or?
Up to the time of the appointment. And they can cancel it either online or through the 800
Well, they can
number.
cancel up to 20 minutes before the appointment and not be penalized?
Correct.
Wow. Because that appointment's going to be wasted if they cancel it 20, 30 minutes, I would think, in most cases.
Correct. In most cases, you would expect that to happen, but people get delayed in their jobs, and there are two sources. If they're not where they could get online and cancel it, they could call the toll-free number and cancel that appointment. At least then, especially if it's a walk-in clinic, they would know that they have the availability to go ahead and not reserve that room for somebody else who may walk in.
That sounds very lenient to me.
Mrs. Barnes.
Ms. Stinson, you said that has Care Here just put in the process of preventing people to schedule more than one? I thought we did that before. That's new?
It was part of what was being reviewed back in April of '09. In speaking with Care Here today, the number of individuals at that particular time who were booking multiple appointments wasn't as high as it is currently, so it's something that we do need to go ahead and implement.
Okay. So we are going to do that now, which I think is a great idea.
Right. We have done that actually effective yesterday.
Okay. And my second question, is there a possibility of an email reminder about appointments, or do we already do that?
We already do that.
So they get a reminder saying you have an appointment scheduled, don't forget.
Yes, they get a 48-hour reminder via email of an appointment that's been scheduled.
Okay.
Mr. Hall and then Ms. Harvey.
And is the $15 or the $25 right now, is that posted on the website where they're making the appointment if it's online, or so they know that be sure to cancel? It's at the top of it up there. Yeah, that's what I thought. Yeah.
And Mrs. Harvey?
People that need more than one scheduled time, like back to back, do you call in, or since that's going to be blocked on the internet, do you have to call in to make those appointments then, or do you call in and say, I'm one of those patients that need 3 blocks at one time, can you flag my name to allow me to do that on the internet?
Yes, if you block one time and then you attempt to block the one below it as an example, you will receive a message that says you already have an appointment. Please call the toll-free number to block additional time. So it doesn't prevent you from blocking. We're not saying that you can't have more than one appointment. We're just saying that you can't do it on the computer. You would have to call the 800 number.
Okay. Sounds like the system has got a lot of fail-safe mechanisms within it. I think it appears that we have made progress. 9 months was 900, and 7 months was 400, and maybe almost 500. So they've gone down.
They have gone down.
Gone down some. How do we collect the $25? I mean, how do they pay that?
Currently, we receive a list from Care Here, and we manually track whether it's the first or the second thereafter appointments. It's not uncommon. We had quite a few individuals who had missed as many as 7 appointments in the first 7 months. And at that point that we identify that it is one that we need to bill for, we will send a note to payroll, and payroll deducts it out of their check.
Okay. All right. You've heard the report, and we have a request that we make it just a flat 15 for each time that they do not show for an appointment, and they can call anytime minutes up to the appointment to cancel. So what's the wishes of the committee?
I make a motion that starting January 1st, 2011, that we implement the $15 per missed appointment, starting with the first missed appointment. Just as a FYI, it is cheaper than our doctor's office, and they do it from the first missed appointment, and they don't even have to pay the office visit on this one. So.
Okay, that's a motion. Do we have a second? Mr. Hall. Now, other discussion? If there's no other discussion, then all in favor of that, please say aye. Aye. Any opposed? Thank you. Well, that concludes all the items that we had listed on the agenda. Is there any other business to come before this body?
I have one more reminder I'd like to remind particularly the viewers in the committee about. We are quickly approaching the end of our dependent audit. The last date for dependent audit is September the 17th. Statistics as of today, we are at 48% completion. So we have still over 50% of all individuals who are required to respond to the dependent audit who have not done so yet. I am very concerned for the welfare of the employees of the county who participate on the plan, who have dependents, that they are going to delay their response and miss the deadline, at which time the coverage for the dependents will be canceled. So it's very important, and I encourage individuals who have not done so to do that, to get their documentation in and get that process wrapped up to ensure your family will continue to have coverage past the 17th.
And I know that she has broadcast to all users this reminder multiple times already, but if there's anything else we can do to notify and encourage these people, I'd like for Ms. Barnes and Ms. Stephenson and Ms. Stinson to see if there's anything we're missing to communicate with these people. Please get that information to them. Mrs. Stephenson.
Even though the letters from Sokovia clearly stated that if you had any questions or problems coming up with the information that they were requiring, you can still, if you are unable to get the information that they're asking for, please call them, because there are some other avenues that, say for example, your income tax was on your computer and it crashed and you can't print that information out. Well, there are other avenues in order to determine that your dependents are your dependents. So please call or advise them to call just to get the information instead of just delaying it.
Okay, so we know which 52% of the people haven't participated yet. So I don't know how far our responsibility goes. So we could create lists and we could send lists to departments, to schools, to whatever, to say, hey, here's your list, you better start checking on this. So if you have any way that you can accommodate that, we need to do that. Ms. Barnes?
And to follow up with what Ms. Stinson said, I've been sending emails out to all Rutherford County employees and then asking our principals to copy and post that same information in the school in several locations so the people without email access can read it, and to talk about it at faculty meetings. I think Ms. Stinson sent that out. And we generate a lot of phone calls, and we in turn give them the Sokovia phone number, and we've answered a lot of questions, and we've directed a lot of questions to the insurance office to respond as well. So I think we're reaching a lot of people. There have been some complications, and we always send them to Sokovia and say call and get the final answer because they're the ones that are handling this. So I think we'll continue to send out weekly notices as long as we can to help generate this process and make sure everyone complies.
Okay, we want to do everything we can to be sure they've had an opportunity. Anything else before this committee today? If not, this meeting is adjourned, and thank you very, very much.